And for severely injured people where we have a long carry-out to do or a long rescue, I can provide comfort. And so they actually really value us that can give narcotics. Okay, so this was like the most recent, maybe not the mission, but the most recent serious mission I was involved with. So you guys been up Mount Side for you hikers? Yeah. Yeah. Everyone's been up Side. So we went up there. Actually, there was 2 of us from Ground Rescue, and a third happened to be right up there too, Hutton, Gordy. We had our friend, the neurologist, with us, and then a couple mountaineers. It was a horrible day. This was good weather. It was raining, sleeting, snowing, blowing 40 miles an hour. But we thought, oh, let's get some exercise today. It won't be that bad. It won't take us that long to go down. So we're, I'm going to come back to that picture in a sec. So we're on Mount Side, 12:15, and our phone dinged. And it was like, oh, there's a mission. A guy has fallen, whatever, 30 feet off the haystack, that top thing, which turned out to not to be true. He's like somewhere down on some ledge or something down there, and extreme back pain, probably has a broken back. That's about all we knew. We thought, oh, that's funny. We're like, 15 minutes from the top right now, getting up the haystack. So lucky us, lucky him. We zoom up there and just throw out. Okay, he's now fallen 30 or 40 feet. It's pouring rain. He's down on this ledge. How would you approach him?
Is he conscious?
He is conscious. He's screaming, well, not screaming, but he is in agony. There actually happened to be a couple, I think there was a woman down there when we got there with him.
Is it safe to approach? I mean, is it a safe ledge or usually?
There's the search and rescue person. Your personal safety, you can't become a victim. Your personal safety. Well, fortunately, they had figured out, even though he had fallen for 40 feet, that there was a way around off the trail, and you could scramble through all these bushes and go up through this mud and try to scramble up these rocks. And we could actually get to them. This picture isn't terrific, but he's kind of fallen from kind of someplace up here. He was looking over the edge and wanted to look down, kind of fell. And then he was kind of lying. This is a natural thing, but he was kind of lying in the dirt and the gravel, but it was steeper where he would have fallen off of. But he was kind of lying in the dirt and gravel. So this is February. He's in a t-shirt and kind of nylon pants. And fortunately, the people with him did some good things. So let's, okay, so we got to approach him safely. So we were able to scramble around there and approach him. Well, then when I found him, he was lying on his hands and knees with his back of us, like the only place that's uncomfortable. And we're on a really steep slope, and it's muddy, and there's no flat place anywhere down there. And he's lying like that in the dirt and the mud. And now, fortunately, his friends have done a good thing. So what would you do if you were his friend trying to help him? Protect him from the elements. Protect him from the elements. Guys, in the short sleeve shirt. It's blowing 40 miles an hour, and it's starting to snow now.
Throw my tarp overhead.
Throw a tarp overhead. Protect him from the elements. Try to keep him warm. Would you move him? We were a little worried he's going to slide off the slope. He wasn't really going to slide all the way, but he was slipping down. Any more history you want from him? Just to be medically oriented if you've arrived and you're the medical person? You can phone a friend over here.
Like, can you move all his extremities, his fingers?
Okay. Yeah. And you asked too, is he conscious? And that was the first time I went, did you hit your head, or were you ever unconscious? Yeah. Yeah. He said no. Yeah. So yes, he could feel his feet and his toes, and he could move everything.
Neck pain?
He did not have neck pain.
Is he bleeding anywhere under his clothing?
Not bleeding. Well, kind of scratched. I mean, his arms were all scratched up, and turned out when I looked at his abdomen, it was kind of all scratched up because he kind of whatever fallen with 30 feet and then kind of slid down. I kind of asked him what position he landed in, and he doesn't really remember, but he actually initially was sitting and moved himself, so he'd already moved himself. position. Yeah, so what can you do in the wilderness? Protect them from the elements, try to keep them.
Yeah, because you were just on a personal hike, so it's not
Yeah.
like you had a bunch of rescue gear with you.
Well, funny thing was, one of the guys thought, I'm going to carry a bunch of weight. So we actually had 2 ropes. And Doug Hunt was up there, and he had a sling for some reason. We spun this thing, and we kind of at least tied him to the hill, and then put a hand line in for kind of other people kind of coming up and down. So now we're up there, and we don't have any rescue stuff. So we're, probably going to top them outside. So rescue has been called, but hours before really they're going to get there with anything. So we had to make some decisions there. I am with the neurologist. He seemed pretty good. We had no flat place to move him to. We didn't really want to, he didn't want to move out of this position. So we kind of anchored him with this rope and got pads under him and got everything on him.
You had a back hurt or?
Yeah, it was all really excruciating back pain. Didn't find really anything else on my, I did a full survey of trying to check him as much as I could. But we didn't have, and just had every bit of clothing and a huge tarp on him. And we just, the neurologist and I just kind of hovered over him. The wind was blowing 40 miles per hour, tried to keep him warm. And he had never lost consciousness. He was, alert and oriented. So I chose to give him a little bit of narcotics at a time to ease his pain, because I figured we had 3 hours before we were anywhere near getting him out of there. So, helicopter's on standby. There's nothing we can do. So so they got there and they had that full evacuation. We don't have any good pictures. We have one of Russell. The weather was so bad, but they have that full blocky blow-up splint now. So we ended up trying to get packs down to make a flat platform, and maybe we should have done that sooner. That was the one thing I thought later. We didn't have enough stuff, and at least tried to get him on, something flat on his back, but he didn't really want to move. So we eventually cut all of his clothes off and got him in 2 sleeping bags because he was cold, and somebody boiled water, and so we got him warmed up. But it was about 4 hours and 15 minutes, and I was standing over this guy, shivering myself. You got to not become the victim. A couple of us were pretty darn cold. Then we had to set up a litter and a raise and a lower and a traverse, and then haul him out. So he had a broken back. He was in the ICU at Overlake, but had good neurologic function. And by the time we got his clothes off and sleeping bags, he was pretty warm. And when we got into the trail, I gave him a bunch more narcotics. So the funny thing was, the medic came all the way up there as a mate. They don't usually go very far, but a medic came up and was fully supplied with IVs and all this stuff. And he said, well, here, he was great. He said, should we put an IV and get IVs? I'm like, I think that's going to be pretty tough. He's been out here for 5 hours, and he's pretty clamped down, and he's drinking warm fluids and says he's warm. I don't think he needs IVs, so we didn't do that. So we got wheeled out into the hospital. Did okay.
So how long from the time of the fall until he was at the hospital?
We got the call, I think it was 12:15. I think he had fallen at noon, maybe, somewhere, 11:45 maybe, 11:30, somewhere he had fallen between 11:30 and 12. We got him to the trail at 5. They got him down pretty quick, maybe 7, so he was maybe at the hospital at 7:30.
So still about 8 hours.
Yeah, it was long. Yeah. So you have to think about a lot of things. There's not a lot of medical things I can do out there, but it's about keeping him from getting cold and hypothermic, and we did a pretty good job keeping him warm, and then trying to make him comfortable. So once we hit the trail, I felt a lot better about giving him more narcotics, but I was pretty hesitant about giving narcotics to this guy who's lying face down and is talking to me the whole time and grunting, but it's pretty nasty. So I kind of give him a little bit of narcotics. You certainly don't want to hurt him, but so it's different than being in the hospital where you're in the, you got full-on nursing watching him. If you give narcotics and they get sedated, you don't. I probably should carry Narcan. I don't carry Narcan. Probably that. I need that. So that's kind of a fun one. So here was another one. This was rock climbing up at exit 38. This was kind of another one where we were pretty close. Had done one mission and we're in North Bend eating and got the call, so we were there in like, I don't know, 25 minutes. So rock climber hit by rock fall. Didn't fall climb, he was just hit by a rock fall. And so what would you do with this person?
Did he have other injuries, or was it really isolated?
It was just one rock. But the mechanism of the trauma was a big rock to the face, in the orbit.
Did he lose consciousness?
Good question. No.
Was he like alert and oriented?
He was alert and oriented. Could see. Not going to have blurred vision.
Do you have any cold packs or access to ice?
No neck or back pain?
No neck or back pain, but a lot of orbital pain. A lot of orbital pain.
When you palpated, did you feel any crepitus or anything?
Yeah, so, I think so. And I was pretty worried. Was a laceration up here, and I was pretty worried about, maybe an orbital fracture here. That's a lot of swelling, and so, when we're on the scene, we have to, do our neurologic exam, right? We pulled as much neurologic exam we could, cranial nerves, and think about the mechanism of the trauma. And we have to think about how to evacuate. Is this a person that can walk? Is this a person that we need to get a litter and wheel them out? Is this a person we need to call the helicopter? We call the helicopter when it's life or limb threatening for the most part. Depends how far we are from getting a person down the trail into a hospital. I'll throw anything in here. This is exit 38, so we're
So how far are you from the
we're
trail?
kind of near Amazonian wall.
Okay.
There's
So,
two up there actually too.
so maybe, 45 minutes walking if all is well.
Yeah, if all's well and he can walk.
Yeah.
Yeah, versus getting a litter and the thing out there, we're not talking a couple hours.
Yeah.
So I've had two up there actually, and this guy we walked out. I was pretty hesitant because, that's pretty life or limb threatening. Lose your eyesight, and you don't really know. You're in the wilderness. You got to make a call. Helicopters aren't the safest thing in the world, but we're pretty close to medical care there. We can walk out and get an ambulance. It's probably an hour maybe from Overlake. So we chose to walk this person out versus the next scenario at exit 38 where there was a woman who took a leader climbing fall and hit the ground about 30 feet and then rolled down. And it had kind of a similar looking eye, but the face was more bashed in with way worse swelling, had flank pain, had knee pain, broken patella, and that mechanism of fall is a 30-foot fall. So what kind of things you want to think about versus, he got whacked hard with a rock, but somebody that takes a 30-foot ground fall.
Splenic rupture.
Splenic rupture. Yeah.
So
Exactly. Kidney injury,
bleeding,
internal bleeding. Yeah, that's a mechanism of 30-foot fall.
So
Yeah.
an automobile accident. And it's
Yeah.
same kind of force.
Yeah. So certainly internal bleeding and head injury. She was conscious, but I don't know if it was just dazed, but she was not all there. So we had to fully immobilize her neck and spine. Because that kind of a fall, I was pretty worried about a neck. She had some neck pain in her back, so we fully immobilized her, but did take her out also on the litter. So it's kind of different considerations. I did not give her pain medication because I was worried about her level of consciousness, and we do have stuff to intubate people, and we used to do it on the ski patrol, but I'm not very comfortable with that. So I chose not to give her pain medication in the field. But actually, we got her immobilized in the she actually did okay. So versus the guy on the outside that had a broken back, he was in excruciating pain. So, but he hadn't had a head injury, so I gave him narcotics. So I'm careful with it, but also you can provide a lot of comfort with narcotics to seriously injured people.
Did you walk her out or get a helicopter?
No, well, we actually took her down the trail in a litter. Yeah, she was
Right,
not
I
that.
mean, yeah, take her
Yeah, it took longer than we wished, though. I mean, everybody got there with the litter pretty quickly because it's pretty close to the trail. But then we had to kind of lower her down the steep slope before we got her to the trail. So it took a little bit longer. She had a fractured kneecap. She did not have any internal bleeding. She had about 8 broken ribs.
Wow.
She had an orbital fracture. Her eye was okay. She didn't have, I mean, she was having a subdermal hematoma or something because she was acting goofy, but it turned out she was okay. So yeah, had she been any worse, I'm not sure how much faster the helicopter would have been because we're pretty close.
Right.
So we're trying to weigh that.
It sounds like with your physician skill set, you're able to think more about like the physiology and the systemic complications, and then make that decision.
Yeah.
Do we need the helicopter? Can they walk?
Yeah.
Do we need all the gear?
And you'll find out the sheriffs like to talk to you
As the medical.
as a medical person, like on that Mount Si thing. And Chris kept calling me on the cell phone and had the helicopter waiting. I'm like, there's no way. I said, the weather is horrible. And but kind of wanted updates. And so it's nice to be in a role where they respect, and we have super competent people doing first aid. We got a lot of EMTs. They got super, like the ski patrol, those people are so competent at splinting. They're so much better than I ever was at splinting. But there's that degree of how many seriously ill people you've seen in the ER and how critically and how fast you see people go from being okay to crashing and decoding in the ICU or something. So I think they appreciate that. You've got a little bit of a layer there to help them judge. Is this going to go bad? If I can't tell if it's going to go bad, then we better assume it's going to go bad pretty quick. And we were all alert this gal may have had internal bleeding, so we were watching her vital signs every few minutes and her pulse and her, she's getting abdominal distension with blood. We were watching her really close and could have turned that, but so we overcall things, but wow, helicopters are dangerous. So that's kind of thing. I think, and on the ski patrol is really competent. As a physician, we would kind of stand back unless they would ask us, but always be there for the head injuries, the neck and the spine injuries, the compound fractures, just to make sure everything was going well at that level of safety. They're very competent, and most of our rescuers appreciate that they get a chance to do something on the ski patrol, and the doctor doesn't just always jump in and take over, as long as they're doing everything appropriately. So, and they like it when you say, hey, let's double check that neurologic exam, let's check this and this, because it's just like being a doctor here, you're teaching all the time. I think that's the other fun thing about it, is we get to be in the hospital, we get to teach too. So I did a lot of teaching in the ski patrol in the outdoor emergency care. I teach abdominal injuries and pelvic injuries, and they actually had to learn childbirth of all things. That was very useful. Oh, that was a good one. I didn't put that one in here. This on the ski patrol round rescue. So nobody's done obstetrics yet, so this is a little bit hard. But we're on the ski patrol. Sometimes people go running at lunch for whatever reason out the Alpental road to get more exercise. And I was in this first aid room, and these people came zooming up in the car. This woman's obviously way pregnant, they say, well, there's an obstetrician here at Alpental. So they got in a car accident on the Alpental Road, and instead of driving down the highway to a hospital, they come across these runners, these Alpental ski patrol. All of a sudden, our obstetrician's up there right now. So they went backwards on the Alpental Road and rolled in with this woman who had been in this car accident. It was not high speed, but anyway. She had some abdominal pain and various things, so they took her. I'm like, oh, this is not a good idea. Bring this pregnant woman here where we have no monitor. There's nothing I can do as an obstetrician unless she happens to give vaginal birth. Well, so we called the ambulance, but it was very amusing that they thought, oh, let's see. So anyway, and then they laughed too because we did have a woman that had acute abdominal pain, and she had a ruptured ovarian cyst in the ski area. And I thought, oh, I think she's got a ruptured ovarian cyst, and she did. So they built me a splint out of 2 masks, those surgical masks, an ovarian splint, and presented me. About this is how Dr. Webb splints ovaries. So I got a lot of jokes, as you can imagine, as an OBGYN. So what about this one? This was McClellan, Butte, back 2009. Obviously, it's winter, and you can see these tracks, these people going. It looks steep from this picture, but it's a bit steeper.
And this is another one that's right out I-90, kind
Right,
of like Mount
yeah. We, for the most part, do I-90. So these are all, between here and Snoqualmie Pass, basically. And we do a lot of stuff up there, too. I don't think so. Okay, so this is the winter climb, and as they got up higher, it got icy. And this was a 100-foot fall from the rock and the snow, pretty close to the summit up there. And he had a harness that was down around his ankles. Obviously ripped his harness off in this fall. He had really bad hip and groin pain, extremely bad. And I was at base. I hadn't left yet. I'd gotten there, but I wasn't up there. So they are radioing me saying, what should we do? And so I'm getting this history. Okay, nausea. There's some seeping wound in the groin, and I'm trying to get them to describe this wound to me. And they're like, well, it's just a little nick, but it's like seeping. And they're like, what do you think? So, what do you think? Miles, you get to be quiet. Let them guess. Because Miles,
Or was it seeping? Like what was coming out of it?
it wasn't blood.
Not under.
No, a little bit of blood. A little bit of blood. But it's kind of seeping, like clear fluid with pink tinge.
pelvis?
Pardon?
And we said in the pelvis?
Yeah, in the groin.
Oh, in the
They were saying kind of in the groin.
It'd be a ruptured testicle.
Good thought.
Ruptured bladder.
Good thought. Good thought. Yeah.
Other internal organ injury.
Yeah. Yeah. So exactly, you're exactly there. Like this, and but they're saying this, but there's like we hardly see anything. There's like this little nick in the skin. Like what about his ice axe? That little pick is not very big. Oh yeah, he had an ice axe and he was crashing down and his harness was down. And I'm thinking, look like an ice axe puncture? Oh, I don't know. Yeah, probably. Anyway, they had to get to skin. When they first gave it in history, they were just saying, oh, he's not even got abdomen. Like, who's gone to skin? It's the winter, the guy's got 3 layers of clothes on. It's exposed, but you got to get to skin and figure out what's going on. So anyway, I got him to get his clothes off and give me this history now. This thing's kind of seeping. Okay, so McClellan Butte's roughly 4,000 feet up from I-90, 3,600 feet up. So they're way up there. Okay, so they're not like near the trail. The weather's not great. It's not bad, but you have pretty good visibility.
And there's no more trauma to the groin?
He had abdominal pain. No, they didn't see anything else.
Yeah.
But no more, but abdominal pain and nausea. And of course, nausea is a worrisome symptom, right? That you've got an internal injury. Could be head injury too. I mean, apparently in this fall did not go unconscious or hit his head, or may have been unconscious very briefly, but was conscious. So getting this history. So I'm down at base, and they're saying, well, what should we do?
Do you have any idea what his vitals are? Like, what's his pulse?
So that's a good question, and I can't remember, but they did, and I think it was like 120. It was, and it may have been like 100 when they started, and by the time like 15 minutes has gone by, and it's like, yeah. Yeah, it's like creeping up there. They didn't have a blood pressure cuff.
Yeah.
Well, it sounds pretty bad.
Yeah. And so this seems life-threatening to me, because I think the guy's got an internal injury. And so they called the helicopter. And sure enough, they did an exploratory laparotomy at Harborview, and he had I'm not sure actually because the ice axe, there was like a stick from a tree, some kind of a puncture thing, and was seeping probably peritoneal fluid. It didn't seem to be bladder and seemed to have missed the intestines, but was just a peritoneal fluid. So he got pretty lucky, but he got a laparotomy, the explorer's app. I think he had some other leg injuries. He had something else. He had some other stuff going on, but the most serious thing. But yeah, so anytime it's really life or limb threatening, this is going to be a long evacuation. This is going to be the 8-hour evacuation. People had gotten there, but there was no like litter. You're going to be lowering him in a sled from anchors, and there's no good way out of here for this guy. So he got helicoptered. So those are the kind of decisions they like to discuss, and many people could have made that decision. I think anybody could have made that decision. So these are the things I can kind of talk about. What can you do? You know, I always try to get them to pee for some urogynecologists, because like that guy, long evacuation, you know, once you strap him in the litter, so you can get him to pee before you strap him that litter, because it could be hours before, 8 hours. So that's always up on my mind as a urogynecologist.
So being a urogynecologist, when you respond, do you ever bring stuff to start a catheter?
You know, I do have some in and out caths. I do, but I've never used them. It's one of those things I took out. I still have a couple, but I take them out because I've never used them. But, actually, had we not gotten the woman, the climber that fell on Amazonian wall out that quick, I probably would have.
Yeah.
Because I didn't want to move her, so that's good. I should put it back in. Yeah, warm, dry clothes, splint them well, because splinting them well gives them comfort. And the more you're moving them out on a trail and bouncing around, the better splinted they are, the better they do. So we cushion them. And then trying to just leave access to their pulses in their feet, its lower extremity, their neurologic function, wherever you can, trying to be able to, and it's hard in the winter when you got them all bundled in sleeping bags to keep access. You want to try to do that, because if something changes, that's when we're going to change the evacuation plan. Like now, if they've lost neurologic function. I didn't put this one in because this wasn't search and rescue, it was a personal thing. We were out in the Olympics, and a friend got hit by rock fall and fractured his shoulder. And I knew better than to put his in because I was sure it was fractured, and I gave it a little try because we were 2 days out in the Olympics in the middle of nowhere. And he was getting, most people do when they have dislocated shoulder, numbness and tingling in their hand, this can happen, but at the same time, the people that I sent out, I said, tell him he has some neurologic compromise, because I knew that would get the helicopter there. And there was no way this guy, he was in agony, he had to wait 2 days for somebody to come in and evacuate him. And so anyway, so we want to keep track of that, because it might change the evacuation plan. So, and I can't say enough about psychologically helping people. And a lot of times people we rescue and come back later, we'll say, we try to get one person to stay at the head and be the one to comfort, update him, constantly tell him what's happening, the litter's on the way, it's going to be here in a couple of minutes, it's how it's going to go, and just that comfort and reassurance means everything in the world to these people that are injured. And, so that's, I think the other thing, even though anybody could do that, you don't have to be medically trained, I think we have some real good skills about helping people there. And I think sometimes there's not a lot you can do if somebody's seriously injured or maybe dying. You can be the person to really be there for them. So.
And Gretchen, correct me if I'm wrong, so that on the lower left, that's that full body vacuum splint that you mentioned? So
yeah, well, that's a bigger, beefier one than we had on this mission, but yeah. We had that yellow thing. But yeah, that's a full body, you have, they were better, but you have air in them, and then you suck the air out, and it like compresses to them. And so we had the guy, and they're amazing. Yeah.
Provide a little bit of insulation as well, and then kind of immobilize everything. Yeah. So
that guy's trip out was so much better. And that's the first time I've used the full body one on a real mission before. I've used the lid ones, but I haven't used the full body. That's just showing wrapping them.
Is it like a hand pump or a foot pump?
Yeah, a hand pump. Yeah. I'm sure important. I'll tell you one funny story. So the first time I went on a mission and we got this new titanium wheel. We used to have this, we call them the wheel that goes on a litter so we can roll them down the trail. It's like a bike tire, like one big beefy bike tire. You put the litter on it and you can roll them down the trail. It's really great. We had these huge tires when I first started. They were like so heavy. It was carrying stuff. So we got these little titanium wheels. It was fantastic. We were like out on this mission. First time we go, we get up there. The tire's flat. And I'm looking at the guys. I'm like, what do we say about this subject? I think it was about rattlesnake or something. I was like, and so we just wheeled them out with a flat tire. And like, now that thing is like strapped to that, so we'll never do that again, but it's kind of funny. And nobody checked that. And the last thing I'm just going to say is, and there was a medical student a few years ago, it was a wilderness medicine class that also had this happen. Wedding day, but she had a wedding dress. Anyway, it was kind of crazy, but so one time we were up, and I actually was on the Hasty team. We have a Hasty team that stays up on the pass in the summer to be closer for accidents. And everyone says, oh, nothing happens, you just drive around and nothing happens. And so the first time we ever went out on that, we're up right at the pass, going down the other, they were going down the other side, and there was this Jeep rollover accident. So imagine 60 miles an hour Jeep rollover, like many times. And there was a guy on a motorcycle who turned out to be an EMT that was first there. Some other people kind of standing there, and then we were right there. And we made some mistakes, I gotta say, on this. And there was this 12-year-old girl who was in this little puddle down there with serious, I mean, her face was like ripped off. I mean, and so I and the fireman on the motorcycle, the EMT, went to her to try to stabilize her and try to maintain her airway because she was like bleeding and in the water, and you know, she was in really bad shape. But we had to get her out of the water. We just had to. She wasn't that big, so we kind of picked her up and got her out of the water and losing her airways. And then there was these 4 other people in various stages of shock, like not seemingly with horrible injuries, but you know, who knows. And so there were 4 of us in the car, so we all kind of like took one person, and it was seemingly forever to a medic gets to I-90. Can you imagine? We're on I-90, the interstate at the pass, and 4 ambulances eventually came because they needed one for everybody. It was 40 minutes, and we were sitting there with this girl screaming, her face ripped off, losing her airway for 40 minutes waiting. And I'm like, is there seriously no ambulance? And guess who arrives? This kills me. BLS, Basic Life Service. They can't really do anything until the true ALS comes. Because I figured, well, hi, I'm this fireman, we could intubate her. But anyway, so it was the longest 40 minutes of my life with this 12-year-old. But anyway, we made some mistakes, and we made a really basic mistake. So if you arrive on a scene, what is the first thing you do?
Assess the safety. Ensure you're safe.
Yeah, ensure your safety off the highway. Make sure you're safe. You're not going to get hit by a truck coming over the. They were off the truck. Yeah.
Figure out how many patients.
That's exactly what we did wrong. We all jumped out. I went straight to this girl that was screaming this fireman and said, I need somebody right now, and went to go to her. There was a 5th person in that car that we didn't know about. He was kind of wandering around and dazed, and then a stupor must have hit his head, and I think we just thought he was one of the cars that stopped to try to help. We totally, until all the ambulance rolled up, and then we're like, well, who's this guy? Totally missed the 5th subject. So we did not have one leader that sized it up and talked to whoever was the most conscious about how many people were in the car. Yeah, so that was kind of a lesson to me. Big mistake. Anything else about that? So this to me is like, you feel like you're in an urban setting. You're on I-90, you know, Washington State, beautiful August day. And it was just like, wow, there's nothing we can do till that ambulance gets here. So, and there's a lot of heroic stuff that doesn't really work, especially in the wilderness. You know, you're not doing CPR forever in the wilderness. That one on, not Kendall, up above Malacca, Caleton, they did CPR forever. It doesn't, pretty hard to do CPR for very long. So heroics don't work very often. So psychological, like I said, can be super important to reassure people. And just recognize that everybody in the party is traumatized. Same thing on the climber that fell on the Amazonian wall. Her belayer tried to catch her, and she fell and hit the sledge and then fell into her belayer, tried to catch her, and they kind of rolled down this hill together. And we were attending to this gal, but the belayer was, she was psychologically a mess. And then I was sitting with her, and I was like, are you hurt? You kind of tumbled down the hill. She goes, oh, yeah, my knee hurts. But she was super traumatized, too. So all members of the party may be traumatized. So that's something we could really help with. That was kind of most of the prepared stuff. You'll see a lot of stuff. You guys are doing. You're going to help people evacuate, not get search and rescue involved. And that's like happened a bazillion times in my career, where you just happen to be somewhere and somebody's hurt, and you give first aid, and it happens a lot.
So, what do you take in maybe your first aid kit? Having your training as a physician that maybe other people don't.
A lot less. I've gotten older and I don't want to carry it. I used to take a lot of stuff. I used to take IV stuff and blood pressure cuff and loads of first aid stuff. And I really pared it down, because what you learn from Dr. Lux and Wilderness Medicine is you got most of the stuff you need to split people. I've always got my step pad. You got poles of your ice axe. You got bandanas, you got clothes you can put pressure on. So I truly have pared down. But what I haven't pared down on is my narcotics. And my friend that got hurt in the Olympics, that was years ago, I did not carry narcotics in those days. And that, I never go out without narcotics anymore. The other thing I always have is my EpiPen. Because I feel like you could really save somebody with a bee sting, or asthma, right? So I almost always carry my EpiPen. So those are my two things. The other thing I had for a while, but I don't know where I lost it, was an O2 stat thing. That was more for climbing, like on Mount McKinley or something. And we had a guy that we were rescuing the guy at Tuscaloosa Lake, Dan Wisconsin, the guy with the bilateral amputations from frostbite. And we went out to recover all the gear the helicopter dropped. And we came back, and one of our own guys had spontaneous pneumothorax.
Really?
He'd had it before. And we had an O2 stat monitor. So I think that's pretty useful, too. So.
Your narcotics and EpiPen, are those like your personal ones that you have left over, or do you have them as part of, as being a responder?
They're personal.
Like how can,
how do I get it?
How would we do it? Something like that.
So I think the best thing is, you ask whoever if you have a primary care doctor or whatever. But one of my good friends ran the ER here forever, and so we would prescribe narcotics for each other to have them for rescue. And we trusted each other. We were both on the faculty here that we weren't going to abuse them. I had a bike accident. I kept my narcotics from that. I have a friend who just had her ACL did, and she offered me all her narcotics. And she goes, is that legal? And I don't know. I said, tear your name off of it. I promise I won't tell anybody. So, but I think most of us that, have the credentials, your primary care doctor is going to prescribe it. EpiPens are expensive. Narcotics are cheap. EpiPens are expensive, and they're kind of big. Yeah.
$10.
Yeah, exactly. I think I got them here for $90, and they only last a year.
Just like Benadryl. I mean, that can buy.
Yes, I do. I agree. I keep Benadryl. I keep, ibuprofen, that kind of stuff. You always want to, of course, get the patient's history and their allergies. So here's another thing. So there was a 16-year-old that fell down off on the haystack and dislocated his shoulder. His father was there, so I could get permission. But I was a little worried before I knew his father was nearby to give a 16-year-old narcotics, up in the haystack. But he'd been up there for a long time. He weighed like 250 pounds. And I was like, there's no way I'm putting a 16-year-old's shoulder in. It's been out that long. And so I think that you have to think about, what their age is, too.
I think another good one that a lot of people don't think about is gloves.
We learned that. We just learned that.
You just learned that, yes. Like you always have.
We were driving home. We were walking victim. There was a stabbing victim in our corner.
Really?
Fortunately, there was a nurse. Yeah. So we were just driving home and just hear about stabbing. The
this was last Sunday night, yeah. I mean, like, there's somebody who's bleeding along. So we pulled over, we went there. There was a nurse, she had her,
She was
that was
stabbed.
a pretty large.
yeah, she was
super deep.
cut, it
Like
wasn't
a centimeter deep.
but all the way, yeah.
And she was like
blood everywhere.
really don't.
Anyway, I didn't have gloves.
Yeah,
but
And the
unfortunately,
medics weren't there yet.
no.
Yeah.
One of our neighbors had gloves, and so he gave us, unfortunately, had extra
The other
gloves.
thing I usually carry that I don't carry is the Laerdal mask for doing
I also have
CPR.
that now, too.
Yeah, I took that out as you get older. And I have a,
Another really tiny one. It's pretty cool.
I have some more missions, but this is more about how to stay out of trouble yourself. Should see if I have the thing. Oh wait, is that the thing about the? Yeah, kind of what. Yeah, EpiPen and antidotes narcotics. We should put Benadryl in there. Yeah, that's just what search and rescue does. So just be prepared. Like when I climbed Mount McKinley, I was the only woman there. I was up there. I was going to do this research on women climbers, and I talked to all these famous people, worked with Tom Hornbein, who else, Brandy Shankley, and there were no women there when I was there. It was really too bad. But I got asked to do a ton when I was on Mount. I was like up 2 nights in a row. 2 in the morning, they kept saying, "Okay, there's a doctor up here." So just be prepared. And so, like, yeah, when I'm doing house climb, I got everything. You know, I got steroids, I got lace, I got like inhalers. I had everything under the sun, and my God, they used every skill I had on that. We had a guy that really tried to die of HAPE up there at some peak. Nobody in my climbing partner, but I got down, and they gave me like a Denali Pro pin, and like all the rangers personally thanked me. They invited me to come back to be the doctor the next year, and I'm like, oh, I don't think so. I can't get the time off. But anyway, so just, it's like you said, have your gloves. I don't have gloves in my car. I do have a first aid kit in my car. Oh, and the other thing I want in my car is a defibrillator. So there's this new thing. Maybe I heard my friend, they're going to maybe have some of us in search and rescue have defibrillators in our home or in our car, and then the phone, they'll page us. And so like, I live across the street from Terry Park in Seattle. I was like, you know, there's hundreds of people there every day. And like, I get to go over and just defibrillate them before the medics get there. So they're coming down in price. I haven't bought one. I think they're $2,000, but. And we actually shot somebody in the field last year, and they survived.
Wow.
Were you on that? I wasn't on that.
We had one up in Soch.
Did you too?
Yeah, well, it was a rescuer who collapsed
Oh, right.
and went into cardiac arrest,
Oh, I
and
remember
they
hearing about
ran
that.
down, got the defibrillator,
Yeah.
worked out.
Yeah, I think this guy's on mailbox. It was amazing.
Wow.
And they shot him in the field. So that's going to be our next. That's not something I'm going to carry around. So if we're not too far away, the medics who arrive have them. We can carry them up the trail. But I wish we'd get those smaller. Because that's obviously a huge life-saving thing. So I think all of us, when those things get cheap enough, we're going to have them in our cars.
So somebody with all your experience, do you ever get asked to, be the cruise doctor or go on adventures or vacations as the doctor?
I have a really busy practice. I hardly get on our own missions anymore. Well, and I've been asked to be the doc on McKinley. They rotate that like 3 or 4 weeks. But, if I'm going to take 3 weeks off, I'm really selfish. I want to go climbing.
Yeah.
So I got asked by, I respect her so much, and I'm forgetting her name. Is it Arlene Bloom? The woman who took the first women climbers to try to climb Annapurna. And she has like one of the best climbing books for women. It's about leadership. It's not just about climbing, it's about leadership. And I can't believe I'm forgetting the name of that book. But she also has a PhD from Berkeley, and she's a woman that was the one who wanted to get the fire retardant or the fire inflammable materials out of kids' clothes and stuff. It's all like, she's way into the environment, but she's a woman climber. But she asked me to be the doctor on a trip of hers to climb to Tibet. She's gotten older and couldn't climb, but it was a big, long thing. But it's hard to get a month off. So I don't know. I think that's, a career choice. If I had something to think about is being an ER doc where you can come and go. You don't have like a set patients that I see all the time that it's hard for me to walk away for a month. I have over the years. I've gotten to go on expeditions. I just got back from Antarctica this winter, but it's my vacation. I stack it up. So, something to do when I retire. Right? So it's I would have liked to have done done the McKinley patrol thing as a doctor, but taken, I think it's either 3 or 4 weeks to take off. It's pretty hard. The doctor thing on the cruise ship, I advise against it. I've spoken on cruises many times. Those ship doctors, they work all the time. They work all. I mean, we had somebody die on one of the cruise things I was on, and we were in Canada, and they had to figure out what to do with the body. I had dinner every night with the ship doctor. They were like so busy.
Oh, wow. I heard if they're giving out free ice cream on the deck, they're making room for a body in the freezer.
Oh no.
So bad.
That's a good one.
Well,
But I would go, oh, so this is really cool. But when I was in Antarctica, I spent a lot of time at the station we were at with the 2 doctors. One was British and one was from New Zealand. And with ALE. And that would be a cool stint. That station's not open that long every year. I think maybe 10 weeks at the most. And they said, well, what do you think we're really here for? And I said, you're really here for an airplane crash. That's why you guys are here.
yeah.
But but their skill set is different. I would have a hard time doing that. They're both family practice doctors. He said one of the #1 things he does is dental stuff. He went through and got a dental program. You can't evacuate. And then the usual stuff. Most of the stuff I probably could have done. But I'm not sure I have the skill set to be down in Antarctica at a station. Yeah.
Well, any more questions for Dr. Lentz?
Anyway.
Well, if not, well, thank you very much.
Oh, well, thanks for coming. I think it'll be a funny time.
And did you have another question?
I'm with Gretchen, by the way, for anybody who's thinking we're taping this, Gretchen at uw.edu.
Yeah,
I got my email before I knew what email was. So, yeah, just ping me. I'm just over on the 6th floor here.
I don't think they'll be able to see that on the.
Oh, no, just for us here, and then I can send that out.
Yeah. So I'm.
Gretchen at UW.edu.
Yeah, you make career choices. I obviously wasn't involved in search and rescue when I made my career choice, but you got to go with what your passion is, and I'm not sorry about what I do. I think being a surgeon, it's like I like to sew up things in the wilderness and take care of cuts and abrasions.
But it's inspiring. It doesn't matter what you specialize in, right? You still help out in the wilderness.
Yep, that was just my first thing. Is like you just got to get your training somewhere if you're going to do this. And my hat's off to the State Patrol. I learned almost everything I know about splinting and wilderness from the